The chair now recognizes Mr. Walter Murillo, the president of the National Council of Urban Indian Health. President Murillo.
Thank you. Good afternoon, Chairwoman Ledger Fernandez, Ranking Member Young, and Chairman Grijalva, and members of the subcommittee. My name is Walter Murillo, and I'm a member of the Choctaw Nation of Oklahoma, and I serve as the board president of the National Council of Urban Indian Health Care, and I am the CEO of the Native Health Program in Phoenix. Let me start by saying thank you to the members of the subcommittee for the opportunity to testify today on urban confer policies. I testify today in support of Chairman Grijalva's bipartisan Urban Indian Healthcare Confer Act, H.R. 5221. This legislation will require agencies and offices within the Department of Health and Human Services, such as CDC, SAMHSA, HRSA, and CMS, to confer with urban Indian organizations, or UIOs, on policies related to healthcare for urban Indians. Few are aware that urban confer policies are a response to decades of deliberate federal efforts, such as assimilation, termination, relocation, and boarding schools, that have resulted in 70% of American Indians and Alaska Native people living outside tribal jurisdictions. A clear communication pathway between federal health agencies and UIOs is imperative, especially during times like the COVID-19 pandemic, when policies are constantly changing and American Indians and Alaska Natives are the hardest hit. The pandemic has taught us that not having a confer policy means agencies have no formal mechanism or requirement to receive our input on policies that impact us. Through the Indian Healthcare Improvement Act, the Indian Health Service has a legal obligation to confer with UIOs. Unfortunately, the federal government has interpreted this to mean that only the IHS has the requirement to confer with UIOs. It's crucial that HHS and all its agencies it operates establish a formal confer process to communicate with UIOs on policies that impact them and Native patients living in urban areas. It's important to note that urban confer policies do not supplant or otherwise impact tribal consultation and the government-to-government relationship between tribes and federal agencies. Support for urban confer is strong among stakeholders in Indian country. Recently, the National Congress of American Indians passed a resolution to call for the U.S. Department of Health and Human Services Secretary to implement an urban confer policy across the department and its divisions. We're grateful for the support of NCUIH and in Indian country on this critical parity issue for UIOs in the IHS system. I applaud Representatives Grijalva, Betty McCollum, Tom Cole, Don Young, Bass, and Eleanor Holmes Norton for introducing the Urban Indian Healthcare Confer Act to allow the formal path of communication between UIOs and federal agencies. We would like to adhere to the phrase that no policies about us without us. Missed opportunities for awareness and information provided by UIOs regarding Native healthcare can be avoided through the confer process. For instance, key information regarding the vaccine distribution for initial COVID-19 vaccine rollout at the end of last year was poorly communicated to all UIOs and created unnecessary hardship and delays in access. HHS initially only directed tribal programs to choose vaccine distribution program. And when HHS was asked about whether UIOs needed to decide between receiving vaccines through the state or through the IHS, it was unclear for weeks as to whether they were expected to make this decision. Ultimately, HHS forced UIOs to decide between receiving the vaccine distribution from the state or the IHS the same day as the initial deadline. And some UIOs were informed by only on the date of the initial deadline. And in some cases, like ours, the Phoenix area office of the Indian Health Service had worked in advance to notify us of our decision-making deadline. As a result of our clinics, many experienced delays in the vaccine rollout. As a result of the experience, many delays in the vaccine rollout. Had this request and deadline been communicated to the UIOs in a timely manner, the UIOs would not have been forced to make a Russian judgment on the jurisdiction selection. This flawed process could have been avoided with an urban confer policy. HR 5221 is an essential parity issue for UIOs that ensures Native people residing in urban areas continue to have the access to high quality, culturally competent health services. We must move past the notion that only the IHS has a trust obligation to Native people, because the truth is the federal government has that responsibility to provide care for all Native people. Urban confer must be established across the HHS to improve further health care delivered to urban Indian patients. Thank you for the opportunity to speak on this important parity issue. I've provided written testimony to the committee, and I'm happy to answer any questions.